Hello, I'm Dr. Yasser Javed and Faculty Lead for Zing Medical Education, the leading provider of accredited cardiometabolic education for UK healthcare professionals. I would like to invite you to a very exciting upcoming webinar on Saturday the 5th of November from 9:30 in the morning, where we will cover all the primary care relevant aspects of the modern management of hypertension, from assessment to diagnosis and management. We'll reinforce the very latest guidance on lifestyle modification and pharmacological optimization, highlighting relevant aspects of both NICE and European Society of Cardiology guidelines. We will also give you the definitive answer to the age-old question as to whether there is an optimum time, morning or evening, for patients to take their blood pressure medication to optimize cardiovascular outcomes. This dilemma was clarified recently by a large randomized control study, and it's now clear what to advise patients. The webinar will also cover the crucial but often poorly overseen elements of assessment, such as appropriate cardiovascular risk assessment. We'll highlight the limitations in some patients of using the 10-year Q-risk score, and discuss the role in some patients of relative risk and using the heart healthy age. We will also cover how to systematically identify target organ damage, particularly kidney and heart related hypertensive damage. Of course, in a Zing medical education meeting, we have to include elements of ECG interpretation, often the most popular aspects of our webinars, where we receive really fantastic feedback. And we'll give you a bulletproof framework for assessing ECG and cover the common abnormalities seen in hypertensive patients, and in particular covering how to identify left ventricular hypertrophy and, crucially, atrial fibrillation, both common consequences of hypertension that mustn't be missed. I'll be joined by one of my good friends who happens to be one of the great cardiologists of our generation, Dr. Ravi Asamal, who practices in northwest London. The discussion, as always, will be case-based, which really is the best way to hang discussion on evidence and guidance relevant to frontline clinical care. This really is a must-attend webinar for any healthcare professional working in primary care, as hypertension truly is a foundation topic, as well as being a key aspect of the NHS long-term strategy to save lives over the coming decade. The webinar will conclude with case-based interactive assessments to consolidate the learning, and all attendees will receive a handout as well as a CPD certificate for 2.5 hours worth of accredited education. I very much hope you can join us, and please do register your intention to attend on the Zing Medical Education website. Thank you very much.